What's happening, everybody? Dr. Z here, Dr. Zuleta's show, and we're going to today is Mind Your Health episode uh, or segment, and today we're going to be talking about diabetes and obesity. What's the relationship between diabetes and obesity? The second thing is going to be talking about the relationship between the problem, how big is the problem in you, like why should you care? And then the third thing is the relationship between the current advice and why the problem is getting worse. So the first thing, the relationship between type 2 diabetes and obesity has actually been now called diabesity. If we go back into time, it used to be that diabetes was not even a public health concern. It used to be that type 2 diabetes and obesity were not thought to be together. At that time, 70s, 80s, the main thing was like HIV and communicable diseases. Even then, the fact that somebody would gain weight or gain weight after they're 30, that was thought to be normal. And actually, the guidelines from the Department of Agriculture were stated at that time that it was normal for a male to gain a little bit of weight after 30, which now we know that is not true. And then there was a doctor, Dr. Walter Willett from Harvard University, was the first one that started to challenge the issue and started to see a very deep relationship between diabetes, type 2 diabetes, and obesity. He started noticing that, wow, type 2 diabetes is very related to obesity. And so that takes us to the second point, which is the relationship between the problem and you. Like, why should you care? Well, you should care because if there are 3 people listening to this podcast, 1 out of 3 people is pre-diabetic. So if you have a family gathering at your home, 1 out of 3 people is pre-diabetic. If you have at work, 1 out of 3 is pre-diabetic. And guess what? 90% of these people who are pre-diabetic do not know that they have pre-diabetes. And so that is one of the problems, and that's why is getting one of the things that make this problem get worse and worse and worse. Now, the issue with what we talked about in the first one, why the relationship between diabetes and obesity, and then this second problem, why should you care, is because most of the advice that was given at that time was mainly, and you've probably heard it, well, this is weight loss is simple. Calories taken in, calories taken out. You have to take less calories in and then burn more calories and you lose weight. Guess what? If I was to ask you what the rate of success of that advice is, you would be floored by the fact that it's actually 99% failure. This was done in what is called the Nurses' Health Study. And the people who were given this advice and tried this actually had a 99% failure. So no wonder why this is becoming a bigger and a bigger and a bigger problem. Also, there's a big issue that the guidelines themselves are not so straightforward, and they actually do not state that type 2 diabetes can be reversible. I just checked them again recently, and they are not. So it confuses a lot of people, and it confuses a lot of doctors. It's not like a conspiracy theory or anything like that, but it is true that a lot of the doctors that give these guidelines have major conflict of interest. So, take it for whatever you want to take it. But the truth is now that we know science has shown us time after time that type 2 diabetes can be reversible. So that's why some of the problems is getting worse. So the truth is that with this advice, we can easily blame and victim blame other people, saying, oh, it's your fault, you're not following the right approach. The truth is that we've been giving the wrong advice to patients for years, and this has been part of the problem. It's getting worse and worse and worse. The second thing about it is that our bodies actually, a lot of people say, okay, you know, depending on your basal metabolic rate, meaning how much your body is wasting, is using up energy. The truth is that if you decrease your calories, then what happens is that your body actually decreases its basal metabolic rate. So it wastes less energy and it contains more energy. So that's not going to do it alone. And so meaning that even if you eat less calories, you're not going to lose weight. So now that takes us into the next point and last point of what is the relationship between the current advice that we're given and worsening of the problem. So the relationship, we can start at the top. The guidelines from the American Diabetic Association, not very clear actually. I mean, of course they're clear about what sort of medications but they don't really specify to the degree that it has been proven that type 2 diabetes is reversible and that is actually a practical goal and should be the goal for a primary care doctor to actually get somebody to have a complete remission of their type 2 diabetes. That's not stated there. Now, the second thing is that this then trickles down into most physicians, and most physicians then focus on managing type 2 diabetes. Me, myself, actually, I was reviewing the slides that I used to use when I used to teach other younger doctors. And my focus in those talks was about how to manage type 2 diabetes with medications. And I was floored because initially when I learned that type 2 diabetes was reversible, I was kind of upset. I was upset at the system that had trained me. I was upset at myself for not practicing medicine with the closest science possible. And so, but I can't be mad at myself anymore because I know that that's the best information I had. That's the best information we had, but we owe it to ourselves. We owe it to our patients to be able to practice medicine in a way that has the latest science and their benefit in mind, which we took that oath of the Hippocratic oath to be able to not do any harm, right? So that is some of the issues of why this relationship of the advice that we're giving patients is worsening the problem, because then what we actually need to do is not put the patients as if they were victims. We actually have to learn the right advice to give them. So now, the last thing is that we also think that we could think that the basal metabolic rate and hunger could be just controlled by what we put into our mouths, but this is far from the truth. What controls that is actually hormones. And so there are hormones such as leptin, and ghrelin, and cholecystokinin, and peptide YY. And these hormones are the ones that are telling the brain to actually stop eating or eating more. There are satiety, hunger hormones. And so the energy expenditure is controlled hormonally. So if we focus on just reducing calories, that's not going to actually help somebody lose weight. We have to focus on the hormonal management of these pathways in the body. So that is it for today. Remember, just like what we talked about, type 2 diabetes is an insulin imbalance rather than a caloric imbalance. So just focus on that. If you're a patient, a doctor, that's the main thing to focus on, so that you could get your patients, or if you're a patient, that you could get this disease reversed. Until next time, Dr. Z here. If you have any questions, comments, concerns, or you want me to discuss anything specific about type 2 diabetes, hit me up, put a message, put questions, and until next time, take it easy.